For many years, substances like psilocybin and MDMA have carried a strong stigma because they were associated with illegal drug use and counterculture movements. They are often dismissed as dangerous and unworthy of scientific study. However, stigma and fear can sometimes prevent societies from exploring ideas that might actually help people. So you might even be asking yourself, what exactly is psilocybin and MDMA? Psilocybin is a natural occurring compound found in certain species of mushrooms. When studied in controlled medical settings, researchers have found that it can affect how the brain processes emotions and thoughts. MDMA, on the other hand, is a synthetic compound that affects chemicals in the brain related to mood, trust, and emotional processing. Scientists are studying both substances carefully to see whether they can help treat certain mental health conditions when used in a supervised setting. Today, scientists are taking a closer look at these substances in controlled medical settings. Research at institutions like Johns Hopkins University has shown that psilocybin-assisted therapy may significantly reduce symptoms of depression in some patients. In addition, clinical trials supported by the Multidisciplinary Association for Psychedelic Studies have found promising results using MDMA-assisted therapy to treat people with post-traumatic stress disorder, which is a condition that can be very difficult to treat with traditional medications. Another reason these substances should be studied rather than banned is that research allows scientists to better understand their risk and safety. The U.S. Food and Drug Administration, or the FDA, has even granted breakthrough therapy designation to some of this research. This basically means that early evidence suggests these treatments could offer significant improvements over existing options. So while stigma once prevented serious discussions about psilocybin and MDMA, modern research is showing that studying them responsibly could lead to important advances in mental health treatment. Instead of banning research, continuing to study these substances in controlled environments may help scientists discover new ways to treat conditions that affect millions of people.
In the 1950s, psilocybin and MDMA were legal, showing massive promise for treating depression and PTSD. Over 1,000 clinical papers were published. In 1970, the Controlled Substances Act ended it all. These substances were labeled Schedule 1, deemed to have no medical value, while publicly framed as a war on drugs. This ban created a massive market vacuum, which helped pharmaceutical companies such as Big Pharma and Pfizer. These use daily use medications like SSRIs, unlike psychedelics, which might only require a few sessions. These Big Pharma alternatives were then able to make trillions of dollars off of the recurring revenue. Knowing the money at hand, pharmaceutical companies and their lobbying groups pushed strongly for a ban on all psychedelic research, labeling it as medically invaluable.
As researchers began revisiting psychedelic compounds in the early 2000s, several clinical studies started investigating whether these substances could help treat serious mental health disorders. Researchers, supported by MAPS, conducted a large Phase 3 clinical trial examining MDMA-assisted therapy for patients with severe PTSD. In the study, participants received MDMA during structured therapy sessions with trained therapists in a controlled medical setting. The results were significant. According to a study published in Nature Medicine, about 67% of participants who received MDMA-assisted therapy no longer met the diagnostic criteria for PTSD after treatment, which was much higher than the control group. Another area showing strong evidence involves psilocybin, the active compound found in psychedelic mushrooms. Psilocybin has been studied for depression and anxiety, particularly in patients who have not responded to traditional treatments. At Johns Hopkins University, researchers conducted a clinical trial where patients received supervised psilocybin therapy sessions. The study, published by JAMA Psychiatry, found that patients experienced rapid and significant reductions in depressive symptoms, sometimes after only 1 or 2 sessions. These findings suggest that psychedelic-assisted therapy may offer faster and longer-lasting improvements compared to many traditional medications, showing strong potential as a future approach to mental health treatment.